to try progressive muscle relaxation for the dental procedure or any medical procedure where this might be possible and supportive for you. Let's start again with some deep diaphragmatic breathing, filling up the belly. On the inhale, hold a few seconds and releasing the air from the belly and the chest all the way. And once more, breathing in, filling up the belly and the chest, and hold, and releasing the belly and the chest even more. Now, on the next inhale, we're going to tense up, tighten the toes of the right foot, okay? So here we go, tightening up the toes on the inhale. And exhaling, releasing the toes of the right foot, feeling what that's like. And do it again. Inhaling, tightening up the toes of the right foot, feeling the tension, and exhaling, releasing the toes of the right foot. And now the other side, left toes, tightening up, curling the toes on the inhale, and on the exhale, releasing the toes of the left foot. And again, tightening the toes on the inhale, feeling the tightness, and on the exhale, feeling the release. And now we're going to shift to pointing the toes of the right foot. Inhaling, pointing the toes away from you, and on the next exhale, releasing, feeling the release of the right foot. And once more, inhaling, pointing the toes of the right foot. And on the next exhale, releasing the toes. And if my pace doesn't work for you, you do it at your own pace, that's fine. And now the other side, the left foot, pointing the toes on the inhale, feeling the tightness of the calf and the foot. And on the exhale, feeling the release of the calf and the foot. And again, on the inhale, tightening the calf, pointing the toes of the left foot. And on the next exhale, release that side. Now we're going to point the right toes to the ceiling, flexing the calf on the inhale, feeling the tightness, and on the exhale, releasing the foot and the leg, feeling that release. And once again, pointing the toes towards your head on the inhale, and on the exhale, feeling the release of the legs and the foot. And on the other side, pointing the toes towards your head on the inhale, and releasing the toes on the exhale, feeling the release. And once more, left toes towards your head on the inhale, and releasing on the exhale. And now, keeping the thigh on the chair, straightening the leg, raising the lower leg up on the inhale, and releasing, feeling the release on the exhale. And again, straightening the leg, the right leg on the inhale, and on the exhale, releasing the leg. And now the left leg, straightening it. Straightening the left leg so the lower leg comes up off the chair, but not the upper leg. And on the exhale, releasing the leg back down. And once more on the inhale, raising the lower leg only, left leg. And on the exhale, releasing the leg. Just resting for a moment, feeling the breath, feeling the sensations of the lower legs. So far, so good. Now, we're going to press the right leg into the chair on the inhale. Ready? Inhaling, pressing the right leg, feeling the tightening of the buttocks and the leg. And on the exhale, releasing that tightness of the right leg and buttock. And again, pressing the whole leg into the chair on the inhale. Feeling the tightness, hold a few seconds. And releasing on the next exhale, that right leg. And now the left leg on the inhale, pushing the whole leg into the chair. And on the exhale, releasing, feeling the release in the buttock, the whole leg. Isolating once more. Inhaling, pushing the left leg into the chair. And releasing on the exhale. Great. Now let's squeeze our legs together on the inhale. Squeezing both legs together, feeling the tightness in the legs, upper and lower. And on the exhale, when you're ready, releasing the breath and the legs. And again, tightening the legs together, squeezing. Feeling the squeeze and releasing on the exhale. And just resting there for a breath or two. So far, so good. Okay, now we're going to move to the hands. And your dentist will appreciate you not moving your head. So we're isolating parts of the body that will not involve moving the head. So let's start with the right thumb. We're going to press the thumb into the hand, into the leg on the inhale. Feeling the pressure of the thumb. And on the exhale, releasing the thumb. And again, pressing the thumb into the leg. And on the exhale, releasing the thumb. And now all the four fingers, other four fingers pressing into the leg on the inhale, feeling the tension in the fingers. And on the exhale, releasing those fingers. Once more, all four fingers into the leg on the inhale. And on the exhale, feeling the release of the hand. Now let's make a fist with the right hand on the inhale. And on the exhale, releasing the fist. And once more on the inhale, tightening the fist. And on the exhale, releasing the fist. Same on the left hand. Left thumb pressing in on the inhale, pressing on the leg, and on the exhale, releasing the thumb. And again, at your own pace, if my pace isn't working for you. Once more, the left thumb, and on the exhale, releasing the thumb. And now all the other fingers of the left hand pressing into the leg on the inhale. And releasing that tension, feeling the tension on the exhale. And once more, pressing the left fingers into the left leg. And on the exhale, releasing. And making a fist with the left hand on the inhale. And on the exhale, releasing the left fist. And once more, feeling the tension of the fist in the left hand. Inhaling it. And on the exhale, releasing that left hand. And just resting for a moment, breathing with the hands, feeling new sensations after having done that. And feeling the weight of the hands. You might notice tingling, pulsing, temperature, airflow on the hands. So far, so good. We'll do a little bit more with the arms. Now let's press the right hand into the leg, the whole hand on the inhale. Hold a few seconds, feeling that tension. And when you're ready to exhale, releasing the hand from the thigh. And again, pressing the right hand into the thigh on the inhale, filling up the belly, and when you're ready, exhaling that right hand tension. And same thing with the left hand now. Pressing the left hand into the leg, feeling that pressure, feeling the tightness of the arm, and exhaling, releasing, feeling the release. And once more, pressing the left hand into the thigh, and releasing a little more this time, releasing that arm completely. And now we're going to press the elbow of the right arm into the right side of the body on the inhale. Squeezing that right arm in to the body. Feeling the tightness. What is it like? And when you're ready, exhaling and feeling the release of that right arm and shoulder. And once more, tightening the right elbow into the body on the inhale. And releasing, feeling the release on the exhale. And now the left elbow, tightening it into the left side of the body. Feeling the tightness of the arm and shoulder. And when you're ready to exhale, feel the release of the left arm and shoulder. And once more, tightening the left elbow and arm into the left side of the body. Breathing it in, feeling the tightness. And then on the exhale, releasing, feeling the release. Great. And now enjoying a few breaths, feeling the weight of the body, feeling the looseness, a new sense of looseness and ease after having done progressive muscle relaxation. And now, if you like, if you need more time because you're still in your procedure, you can start again or find new places to tighten and release. And my hope is that you'll find this technique a source of ease, a way to release anxiety and tension so that your procedures can go more smoothly and more easily for you. Thanks for listening.